Is there a genetic risk for cannabis-induced psychosis? Have you ever wondered why some people experience psychosis after using cannabis while others do not? This question is especially important when we consider the link between cannabis use and first-episode psychosis, or PhEP, in individuals who may be at risk for schizophrenia. Cannabis-induced psychosis can show symptoms like hallucinations, delusions, and paranoia, which can resemble those seen in schizophrenia. Research indicates that genetics play a significant role in this risk. If someone has a family history of schizophrenia, they may be more likely to experience psychotic symptoms after using cannabis. This connection suggests that certain genetic factors can make some individuals more vulnerable to both schizophrenia and the psychotic effects of cannabis. One of the most studied genes in this area is the AKD1 gene. Variants in this gene have been linked to a higher chance of developing acute psychotic symptoms after cannabis use. Another gene, known as COMT, has been examined as well, but the evidence regarding its direct impact on cannabis-induced psychosis is less clear. These genes are involved in how the brain processes substances like tetrahydrocannabinol, the main psychoactive component in cannabis. Interestingly, the risk is not just confined to those with a clear family history of schizophrenia. Polygenic risk scores, which look at the combined effects of many genetic variants, show that individuals with a higher genetic predisposition for schizophrenia are more likely to experience psychosis after using cannabis. This means that even if someone does not have a family history, they could still be at risk due to their genetic makeup. Cannabis use can also influence when schizophrenia symptoms appear. For those who are genetically predisposed, using cannabis may trigger symptoms earlier in life, sometimes by several years. This is particularly relevant for first-episode psychosis, which often starts in late adolescence or early adulthood. Cannabis used during this time can accelerate the onset of psychotic symptoms. From a clinical perspective, these findings are important for understanding schizophrenia diagnosis and early intervention. Health professionals are encouraged to consider family history and genetic risk factors when assessing individuals who present with first-episode psychosis and a history of cannabis use. Identifying those at higher genetic risk can help guide treatment options and inform discussions about the risks associated with continued cannabis use. In summary, there is strong evidence that genetic risk factors, especially those linked to schizophrenia, increase the likelihood of cannabis-induced psychosis. Specific genes like AKD1 and broader genetic predispositions play a significant role in this relationship. Understanding these genetic connections helps clarify why some individuals develop psychotic symptoms after cannabis use and supports early identification and intervention for those at the highest risk.